My name is Nico Woodward. I'm a registered nurse from New Zealand. I work in the emergency department. I put my career on hold to travel around the country talking to local people about the risk of underfunding to their health service. Morning shift, just like a good old start to my day. It's dark, it's cold, and the roosters are going.
And it's not because of a patient I'm getting up early, it's Simon, the ball campaign coordinator.
Today is definitely an earlier start than what I'm used to.
Oh, right, okay. I thought nurses got up at 2 in the morning.
Well, sometimes we're up at 2 o'clock in the morning, but we wouldn't usually get up that time. I mean, we do seem like we stay awake at all times in the morning, but sometimes we do need sleep. We're not zombies, even though we may work like them. So we're off to sunny Stirling Point in Bluff. We've got a group of volunteers here ready to help us install our cutouts on the first day of our roadshow. We're going to be going for the whole of March until around the 29th, stopping in 38 different locations along the way. We're building up an archive of stories that really highlight what it's like for people using the health service and people who are working in the health service as well. I went into nursing to help people, and when I can't help someone because of issues of understaffing and under-resourcing, it's really distressing. There was this one instance when I had a young woman come into my emergency department. She had appendicitis, and there was a 3-hour delay before I could get her adequate pain relief because I wasn't able to find a doctor to prescribe that for me. Our job is to care, but when we're understaffed and overworked, we can't provide that care. When we are sick, our shifts aren't covered. When we request leave, we can't get leave. And when people leave for a new job or they're burnt out, they're not replaced. So that just adds to an already overburdened and overstressed workforce. I have my own stories and I've heard it from my colleagues, but I want to hear from the people around the country at the coalface, both those patients and people who work in health. Their stories are really important to hear and to be told. You can find us on Facebook/YesWeCare.nz, and you can share your stories with us through the YesWeCare website, through YesWeCare.nz. You know, if it wasn't quite so cloudy, I'd be totally keen for a swim. Well, I might do, but it's a bit rocky down there. I might not come out, and then somebody have to save me in, and I'd really experience the health service firsthand.